Care for Reproductive Health on Thursday organized a day-long health dialogue at the Girls Guide School in Bakau. The dialogue features targeted schools such as St. John's School for the Deaf and the Gambia Organization of the Visually Impaired, GOVI, with focus on sexual and reproductive health. The dialogue was aimed at creating a safe platform for young people with special needs to interact with health experts on reproductive health. The program provides a unique opportunity for those vulnerable young people to interact and engage with health experts on sexual and reproductive health matters. Speaking at the event, the founder of Kerr for Reproductive Health, Fatou Sise, highlighted the purpose of the day-long dialogue.
The purpose of this day-long summer camp is to cater to the specific needs of boys and girls. We seek to equip them with necessary information to protect themselves from infections, violence, and most importantly, to provide them with a clear understanding of puberty, menstrual management, and how to prevent unwanted pregnancies. Additionally, we aspire to change perceptions, attitudes, and behaviors that perpetuate violence against women and girls, particularly in the context of early and forced marriage and female genital mutilation. Our team of health experts, along with the national coordinator of the Network Against Gender-Based Violence, are present here today to engage with these incredible students.
She stressed the importance of breaking the culture of silence surrounding sexual and reproductive health in order to have open and honest conversations with young people about these important topics.
As a married mother of 4 girls and a boy, growing up in a traditional household, Mandinka household, I never had the opportunity to discuss matters of menstruation and sexuality with my mother, as it was deemed inappropriate and strictly reserved for the elderly. Consequently, I had to rely on friends and books to gather information about sexual and reproductive health issues. I am determined to spare the current generation from the challenges I faced. It is evident that we need to strengthen our health system, provide comprehensive sexuality education, and ensure gender responsive and rights based healthcare. However, we must strive to improve our legal justice and educational system to tackle existing and emerging challenges around reproductive health issues, and more importantly, we need to engage with young people at an early age to address issues that profoundly impact their lives.
The representative from the Ministry of Basic and Secondary Education said that the ministry is working with partners to improve health education.
MOPSI is working in alliance with CSOs and governments to improve and expand reproductive health education and special health services that respond to the need of the young ones. Through programs, MOPSI work to ensure young people can access adolescent and youth-friendly health services that provide correct sexual and reproductive health information, modern contraceptives, sexually transmitted infection including HIV, AIDS, and pregnancy tests as well as a range of other services. MOPSI also work to ensure community members, including community leaders, parents, and other caregivers. They are all well informed about how health services can help children and young people and engage them to support the provision of these services. MOPSI also listen to adolescents in the schools and work with them to tailor youth-friendly health services to the local context based on a careful situational analysis of the health and needs among young people.
Daniel J. Mendy, principal of St. John's School for the Deaf, emphasized the importance of understanding reproductive health, especially for young people.
It is therefore important that human beings understand how to remain healthy in reproductive life. Unfortunately, some of our young ones get exposed to adult life at very young ages, hence resulting in unwanted pregnancies. Another challenge is the abuse of prohibited substances like drugs, alcohol, abortion, which results in mistakes that could affect the reproductive systems in our future lives. I wish to note that most such mistakes are avoidable if people are equipped with the right knowledge and information as we are doing today.
People with disabilities in the Gambia continues to face multiple barriers to accessing reproductive health care service. Care for Reproductive Health is a non-profit community-based organization in the Gambia that works to expand access to reproductive health rights through education and awareness. The organization members are media professionals with a proven track record in communication and health advocacy. Reporting for Kerr Fatou, I am Ramatulai Jao.